Hello, Dr. James Marcum with another biblical prescription for life. Today I want to talk to you about some more treatments we can add on for spikeflammation, which we've talked about in great detail. But before we do that, let's turn to a biblical prescription, and that's in Colossians chapter 1, verse 9. For this reason, we also, since the day we heard it, do not cease to pray for you and to ask that you may be filled with the knowledge of His will in all wisdom and spiritual understanding. So let's hold that with us as we seek to understand what to do about spikeflammation, this disease that's been triggered by the pandemic. All the people that have had COVID have had spike protein in their body. All the people that have received the vaccination, the boosters, have also spike protein in their body. It's caused many people side effects. It's estimated that 1 in 35 that have been exposed that will have side effects to this. We've also seen the death rates go up since the introduction of the vaccine, so it's still a problem. I want to encourage you to watch the whole series on spikeflammation, this new disease, and you can find that on our website, heartwiseministries.org, and this is a continuation from all of that. And I really think you need to watch all the old videos to come up to the current recommendations. And now we're talking about treatments for chronic spikeflammation when everything else that we've done is still not doing the job. Here are some things that you might try and consider. I want to introduce you to some excellent websites. And one, they've done a real good job on this, and that's the FLCC Alliance. FLCC Alliance. They take a little bit different approach than I do. I focus on enhancing the immune system, starting out with a spiritual approach, going back to the natural things that we can do first to enhance our bodies, and then only using these other treatments when other things fail or the risk-benefit profile changes. So with that said, I'm going to review some of the things that can be added on to the treatment of long COVID, those who still have symptoms, despite doing everything that we've talked about. One of them that's recommended is resveratrol, about 500 milligrams a day. And that substance can also be found in the peel of a red grape. If you don't want to eat red grapes, you can buy this supplement. It's anti-inflammatory, it's cardioprotective, and it does have some anticoagulant properties, and it does help break apart things in the body. And some studies have shown that it does actually bind to the spike protein and help in its removal. I think there's low risk in trying this. If you want the references on it, go to the flcc.net website. They have that reference on resveratrol. Of course, everybody with long COVID still having active symptoms, the spike can generate clotting. So you still need to think about what level of blood thinner, if any, you need to be on. A minimum would be a baby aspirin a day. If your D-dimer is positive, you might want something stronger, depending on your overall risk profile. Another substance that's recommended if you don't get enough of it, and you usually get this in a diet filled with fruits, vegetables, nuts, and grains, is magnesium. And they recommend 100 to 200 milligrams a day if you want to try a supplement, though I recommend eating vegetables, okay? Magnesium is a very important trace elements that's involved in conduction system in the heart. All parts of the body needs it. And a deficiency in it is associated with mainly cardiac problems. So magnesium is important, but we get that in our diet. So you probably don't need to take a supplement for that. Another thing is the omega-3 fatty acids. You can get this in things like flax, foods like nuts, especially almonds. They have anti-inflammatory properties. You can also get the omega-3 fatty acids in supplements. It also helps improve the lining of the blood vessels, the endothelium. Another chemical that might help you is coenzyme Q10. And I don't recommend these in people that have balanced diets. One of the other ones that people don't usually think about that's been shown is bromelain, 500 milligrams twice a day. It has been shown in some studies to actually cleave the spike protein. And it might even be used in addition to a substance called N-acetylcysteine at 600 milligrams twice a day. So you want to talk to your person that's managing your care whether you should progress to these bromelain and N-acetylcysteine because they carry a little bit more side effects than some of the other treatments we've recommended. But some people might need it. Another one is berberine, 500 to 600 twice a day. It can help you as well, help with the spike protein situation. But you have to be careful with that, especially certain medicines like cyclosporin and during pregnancy and breastfeeding. But you need to go and look at your overall health profile. But that might be a consideration for one. But the one I wanted to focus on most today is one that might help the most, but it carries the most risk, and that's nattokinase. Nattokinase. And it's a serine protease, and it's extracted, they pulled out from natto. And that's a traditional Japanese cheese-like food that's produced by the fermentation of soybeans with a bacterium. So they get this nattokinase from that process. And nattokinase both has fibrinolytic. It can break apart fibrin clots, and it helps against platelets, but it also has evidence that it can cause cleavage that can break apart both the spike protein and amyloid proteins. So nattokinase might be beneficial in some people that have long COVID that continue to have symptoms, especially for those that maybe got a bad batch and are still producing spike protein. The dose is 100 to 200 milligrams twice a day. You can buy it in your health food stores, but you need to talk to your doctor about it because it increases the risk of bleeding. And you have to use it very carefully in older people, people that have renal failure, hypertension, or those that are using other blood thinners. But that might be a consideration as a last resort. Once all these other things have been added, nothing seems to be working. Nattokinase, the risk and benefits might be considered, and that might be something you think about. One last thing I want to leave you with today is there's Dr. Peter McCauley has a wellness site, and they do have a substance that they're selling where they put all of this in one pill and they sell it to you. And I think the cost of it was about $60 a month. That's a consideration as well. But most of this you can get with a healthy, balanced diet, eating correctly, and then adding on things based on your element of symptoms and the risk-benefit profile that you might individually have. But I wanted to add these onto your regimen to consider, especially the nattokinase, and check out this FLCC Alliance. This is something you might want to look at. It might add to your understanding of how to treat spikeflammation. But of course, I think the most important thing is having God as a healing force in your life, letting you lead in all things. And let's get back to Colossians 1 verses 9. For this reason, we also, since the days we heard it, do not cease to pray for you. So we need to pray for each other and to ask that you may be filled with God's knowledge of His will for your life, your treatment for no matter what you're going through, in all His wisdom and also spiritual understanding. So let's remember the source of real truth, our real authority. People are trying to distract us and distort things, but I think as we pray for each other, we focus on the will of God, God will keep us on the right track. So these are some things I wanted to add to our treatment for spikeflammation. I'll be back real soon with yet another biblical prescription for life.